Soaring cases have sparked a rush across Canada for those rapid antigen tests. Many people are hoping the self-test kits can provide an extra layer of security to help keep their families safe, especially over the holidays. But as Mike Le Couteur explains, those rules and recommendations for rapid tests depend on where you live.
Day one of the rollout of rapid tests in Quebec started early and ended just as quickly. People lined up in the freezing cold just to get their hands on a pack of 5. I was expecting a lineup, but not like this, said this woman. Minutes later, relief from another customer. Pop-up distribution sites have been set up across Ontario with similar scenes. This line snaking around Union Station in Toronto, underscoring the scarcity of supplies.
The people of Ontario have already gone through the Hunger Games vaccine edition, and now they're going through the Hunger Games rapid test edition. It's simply not fair.
Meanwhile, in BC, rapid antigen tests still aren't widely available to the public, and it's frustrating some frontline healthcare workers.
We have been sitting on these tests here in British Columbia for over a year now, and I do not understand why now we are in a bit of a panic and the public is just asking for these, why we haven't been more proactive.
The frustration is coupled with confusion over when to use a rapid antigen test. Quebecers are being told to use one if they have COVID-19 symptoms, but in Ontario, you're supposed to use one if you don't have symptoms.
Appreciating that we're in the middle of a pandemic, the Omicron wave, things are dynamic, they're changing all the time, but crisp, clear communication is what Canadians need right now.
While a spike in cases of the Omicron variant have caused a run on rapid tests across the country, public health experts warn they are not the gold standard PCR test. Adding masking and social distancing remain important.
A negative rapid test can't be used as a license to go out and be reckless and disregard all public health measures. But if we use them in conjunction with everything else, they can be very useful and they can help.
Especially if people want that extra peace of mind over the holidays. Mike Le Couteur, Global News, Ottawa.
The Omicron variant and the prospect of another COVID Christmas are prompting plenty of questions from viewers. And to answer some of those, we are joined now by Dr. Banerji, who's an infectious disease specialist with the University of Toronto. Dr. Banerji, thanks so much for joining us. You know, we've heard that news about Moderna and the effectiveness of its booster shot. So the first question for you comes from Erna Jean, who says that my first 2 vaccinations were AstraZeneca, then she had the Pfizer shot 6 months later. Does it matter what booster shot she receives?
So basically, I consider Pfizer and Moderna like Crest and Colgate. They're basically the same. The buffers are slightly different, but they work in the same way. So right now, either of the messenger RNA vaccines are fine.
Okay. Next question comes from Dale, who says that the vaccines that we're currently using are for the earlier COVID variants. Of course, that's what they were designed for initially. But now we have a new variant. Do we need to start trying to make a new vaccine altogether?
I think that there's some controversy. I mean, if you listen to Dr. Fauci in the States, he'll say, you know, it seems to work. And recently the booster, as you said, for Moderna, seems to cause a good immune response. But some of us are wondering, you know, if the vaccine was designed for the original Alpha variant, maybe it's time to look at updating the vaccine, especially if it looks like, you know, with 2 shots, the effectiveness is going down until you get boosted. So I think that's a question that we'll have in the future, especially as mutations occur, like the influenza vaccine. Maybe it needs to be updated.
Yeah, and we have heard, of course, from Moderna and Pfizer, both with plans to develop new vaccines to better match the Omicron variant if needed. Next question for you comes from Karen, who asks, what are the symptoms you feel if you test positive for the Omicron variant?
Well, it depends. It depends on many different things. It depends on how old you are, what your immune status is like, if you've been vaccinated or not. From what I understand, Omicron is similar to Delta, and so you can have symptoms all the way from no symptoms, just a mild runny nose, cold-like symptoms, all the way to more serious symptoms. The more serious symptoms are, you know, if someone's not vaccinated or someone's compromised, and so they couldn't, you know, take the vaccine as well. So it really depends on many circumstances.
Okay, next question comes from Pat asking about transmissibility. So wondering if the Omicron variant is more transmissible when we touch surfaces, for example, or is it mostly airborne spread? What do you think?
So there's been some controversy over this over the years, and I've thought almost from the very beginning that COVID was airborne. And now more and more people are saying that it's airborne. So it's really not, touching surfaces, even though you can get viruses that way through droplet spread if someone's coughing or sneezing. But a lot of people are saying that's really through these small particles that linger in the air for a while. And so, and that might impact ventilation systems, the kind of mask we wear. But I think that we're thinking that it's more airborne than from touch. Last year, people were worried about grocery bags and shopping carts, and I really think it's more the air that we're concerned about.
Dr. Anna Banerji, an infectious disease specialist from the University of Toronto, thanks so much for tackling some of those questions for us. Really appreciate it.
My pleasure. Thank you.